Here's some information on acute bloody diarrhea. There are many different types of etiologies. It can be bacterial, such as Shiga toxin, E. coli, Shigella, Campylobacter, and Salmonella. You can have intestinal amebiasis. This is typically found in resource-limited regions. You can have an inflammatory bowel disease like ulcerative colitis or Crohn's disease, and you can have ischemic colitis as well. Your evaluation, typically in the emergency room or in the primary care clinic, typically involves stool studies, stool culture, Shiga toxin assay, fecal leukocytes. You can do abdominal CT scans for suspicion of ischemic colitis. This is when you have hypoperfusion of the bowel that can lead to necrosis. You can also do endoscopy if you suspect IBD, and this is typically in cases of a progressive acute bloody diarrhea course, or a acute bloody diarrhea that has a waxing and waning course. The treatment and the management typically depends on the etiology. In most cases where you need fluid repletion, if you have hypovolemia, for instance, you prefer oral over IV fluid repletion. If it's an infectious cause, you usually want to do empiric antibiotics, especially in severe disease in elderly people and in immunocompromised people. The one exception is STEC. If it's Shiga toxin, E. coli, you don't want to do empiric antibiotics. That usually resolves on its own.